I was shocked to learn this. I mean, I'm serious. I did not know the care I provide and my colleagues provide, including nurses, occupational therapists, whatever type of clinician they are, only accounts for 20% of your healthcare. It is just mind-blowing to know that there's so many other determinants of healthcare. And the term we use, the global term we use, is social determinants of healthcare. Let's find out. Hi, I'm Junaid, neurocritical care, stroke, and epilepsy specialist, and today we're going to talk about health equity, and we're going to give you a brief introduction of social determinants of healthcare and how digital health technologies can bridge the gap to bring better healthcare to you. Now, first, let's understand. I mean, this is a big issue. Healthcare is not in isolation. We live in an environment, and that environment changes us, that changes our genetics, that changes our situations. Those situations make us a different genetic being in itself. We know that, nature versus nurture. However, what we're trying to figure out is that how we can bring better healthcare to the masses. And this is extremely important because if you're building a startup right now, you're going to understand that the health equity is a big, major focus and goal for both startups, governments, non-governmental organizations, everyone. The digital health startups are going to bridge the gap and may be able to bring these new technologies to people and provide better health outcomes, because it's not just about sick care, the one we provide in the hospitals and clinic. It is about healthcare. As we move from sick care to healthcare, we're going to see digital health technologies making a massive difference in people's lives. So let's understand some few definitions, because as you know, I'm a fan of definitions. It's important that we clarify what we're talking about in our minds. So World Health Organization defines health equity is achieved when everyone has attained full potential for health and well-being. That is the super goal that we work for. However, if you look at UHHS, which is United States Health and Human Services, their main goal is providing effective health and human services by fostering sound, sustained advances in science, underlying medicine, and public health and social services. So the super goal defined by the World Health Organization is actually replicated in United States Health and Human Services. Their main goal is to foster sound human services that can in 4 areas. Number 1, medicine, of course. I mean, healthcare is medicine, part of it. However, public health, social services, and sciences, all of these combined can produce the health and well-being of a nation. And therefore, that is the defined goal for UHSS, which is Health and Human Services for United States. I mean, health equity, inequity is a big, big issue. And clearly, a lot of it does have to do with the economic realities as well. This chart actually explains how significant the difference is. A rich person can live up to 15 years more than a poorer person. And that's just not fair. And with the new digital health technologies, with the access of virtual care, with the access of newer, better mobile applications, people can define both behavioral changes better and live better. So therefore, digital health technologies is a massive opportunity to truly bring healthcare, not just sick care, in terms of both medical care and non-medical healthcare as well. Now we have seen this, right? I mean, global life expectancy has massively improved. Since before 1960s, the average life expectancy was 54. Now the average life expectancy globally is 73. However, people are not living fully. They're not living healthy at the end of their life years. So it is important that not only increase the life expectancy, but it is also important to improve the quality of life within the life itself. We cannot talk about health inequality without talking about race. Unfortunately, the data is there to support that Black, Hispanic, Asians do get less care as compared to our Caucasian friends. And one of the core reasons is about the socioeconomic status and social determinants of healthcare itself. And therefore, it is extremely important that when you are designing a new health application, you understand that. And this is again very important for the developing countries as well, because we're seeing that 4.5 billion, actually now it's 5 billion people who now have access to mobile phones, internet connectivity. Interestingly, there are people with less availability of clean water, but they would have internet and mobile phones. But we can educate them. We can do behavioral changes. We can make sure they have digital literacy. And when we are designing those helpful, meaningful behavioral changes as well, on top of providing virtual extended medical care, the overall health equity becomes more and more an attainable goal. Because literally, when we look at the whole scape of things, we would wonder that can we ever achieve health equality? But with these new digital technologies, it provides a hope. It provides a promise that we can design newer and newer systems that will be available for all. And that is just not what I'm saying. This is literally where the industry is moving towards. If you look at the number of funding that has gone into health equity based applications and startups, you're going to see there is a significant improvement that we saw in 2021. More and more funding, both in terms of non-governmental organizations, government grants. More importantly, there's a business opportunity in it, and more VC funds are actually backing startups that have health equity in mind. AWS just recently announced a health equity grant, and it constantly updates that health equity grant as well. Therefore, we see that more and more companies and health startups are being generated, and these health startups and companies are being backed by significant amount of public and private money. Social determinants of health is going to be key important thing. As a matter of fact, ONC, Office of National Council, which governs health IT in US, have now in the version 3 have determined that SDOH, that's the term we use, social determinants of health, they want to make it pervasive. They want us to collect data on it so that we can target therapies and we can target interventions for not just the medical care portion of things, but rather they can do interventions that are going to help with their physical environment, with their behavioral changes, etc. And hopefully when they are more mindful, when they are more better in their health, they can improve their social economic status as well. Because at the end of the day, a sick person cannot work better, faster, more. And therefore, when you are healthy, you can change your socioeconomic status from a middle class to a higher class, from a lower middle class to higher middle class, and of course, from being poor to having a rich personality. Because at the end of the day, your health determines your wealth as well. Now let's look at the key aspects of intervention. This is from McKinsey, and they divide basically the social determinants of health into 4 major categories: physical, mental, social, and spiritual. Literally, there's tons of opportunity in each and every one of them. And when you can design systems, even niches, for example, literally, I'm working on a neurology and psychiatry applications. Why? Because I'm a neurologist, I know how to deal with those patients, and I understand there's a significant problem that I can help with. When I can help with these niche problems, can be helpful to patients, providers, increasing digital literacy, and making sure that the patients become part of the care team as well. And it's not just a one way from the provider to the patient, but it's actually a two-way communication. So there's such a huge amount of opportunity in bringing these new solutions, and more of these solutions may be started with a niche, but they can expand, they can develop into a full-blown ecosystem. And therefore, as we see that as the government pushes for it, more and more companies are going to fund it, and as more and more companies going to fund it, you're going to see more and more people using it, and then it is the Uber movement, right? Look, I mean, clearly, who would have thought that you're going to get into a private car in a private citizen rather than a cab? That is what we call the barrier. Once you have this community acceptance that, hey, Uber is one way to transport, the minute you have that, then you have so many more things. You can have food deliveries, you can have other things that are going to open up. And that's exactly what's happening in digital health. As more and more companies are coming in, as more and more patients are seeing the advantage, then the network effect, then the people telling another people, and more people using this can bring these applications to more and more life. And you're going to see they're going to explode in the next 5 to 10 years. If you would like to learn more about how I built my startup, please leave it in the comment. We can do a full series on how to develop a full-blown digital health startup. And I'm happy to share my experience, my problems that we have to solve every day, how we were able to get talent, etc. So make sure you put it in the comment, because we strongly believe if you save one human life, it is as if you save the whole mankind. And therefore, this information can be publicly available as how I developed my own startup, and I'll be happy to put it out there for the world to see. But again, I just need to know if it is something you would like to see, or it's just something that I'm assuming you're interested in. Make sure you put it in the comments, subscribe. Thank you so much.